In the dust and dirt, another emergency setup of a crisis fever testing clinic. The line of cars stretching down the road as news of Australia's youngest COVID-related death hit the town of fewer than 5,000 people.
Yeah, a bit stressed out about it, a bit panicky because you're very worrying, especially with young kids.
A bit surprised, actually. We thought it might have come in with one of the fly-in, fly-out workers sort of thing.
Contact tracers are investigating if the FIFO mining network is involved in transmitting the infection to 30-year-old Nathan Turner, who died on Tuesday and later tested positive for coronavirus. But focus is also on the Rockhampton nurse, whose case sent an aged care home into lockdown a fortnight ago. She's told authorities she travelled from Rockhampton to Blackwater earlier this month to watch a sunset, but had no contact with others on the 400-kilometre round trip.
Obviously it is a bit curious, and while it might just be a coincidence, our public health unit will investigate.
It is disappointing that this nurse made the trip out to Blackwater when she was experiencing symptoms.
The ABC understands health authorities are still seeking more information from the nurse, though her account suggests an unmatching timeline.
My understanding is that he had symptoms prior to her travel to Blackwater.
The mysterious case in a town that was previously COVID-free has sparked an emergency plea for widespread testing.
Some old bloke that I lived behind pestered me and he'd get rid of him when I come up.
Don't wait for a phone call that you might be a contact. Get tested.
Mr Turner's partner, Simone Devon, is in self-isolation and has tested negative to the illness, though her workplace has temporarily closed. Mr Turner had prior medical conditions, but because he died with the virus in his system, it's counted as a coronavirus death. A second coronavirus test on Mr Turner has returned a negative result, but the Chief Health Officer says that test was contaminated and she's dismissed the findings.
I believe it was a positive.
But still no closer to knowing where it came from and if or how far it's been spread. Alison Horn, ABC News.